I'm here with Erik Borchardt, founder and CEO of Aesthetic Enterprises and Arizona Aesthetics. Erik, tell me your story about hair loss.
So in about 2007, I started noticing some thinning around the crown. Spent a lot of time on the internet trying to figure out, like, what am I going to do? Was a little embarrassed by it. In those days, the technology wasn't as good, so there was new technology, was low-level laser therapy, like laser caps. So started using that for about 6 months to a year. Didn't do exactly what I wanted, but it slowed down the hair loss. So I figured I got to add something to this to really make my results a little bit better. So then I started using minoxidil, DHT blocker, some shampoos with ketoconazole in it, which is an antifungal that helps reduce DHT on the scalp. So I started to make some progress there. But it wasn't until later on into the 2020s when I really made progress, which was adding all of that and then stem cells injections into my scalp that made the huge difference in growth instead of just, maintaining, basically. This was more about regrowing than it was about just maintaining. But that was very important. If you look back, that's almost over 20 years ago, right? Close to 20 years ago. In those days, to just maintain it for that time really gave me the time for technology to kind of advance towards getting better, just different technologies out there that would help you actually regain growth instead of just keeping it the same.
And would you say that the hair loss industry, as it stands now, mostly focuses on maintenance instead of growth?
Yeah, so the products that you see out there that most dermatologists will give out are finasteride prescriptions, minoxidil, things of that nature. They don't grow a tremendous amount of hair, but they do a very good job of maintaining the hair. So the unfortunate part is most clients don't realize that. They think they're going to use that and grow massive amounts of hair. But it is working in the fact that if you use it, say you're using that for 10 years and your hair stays the same and it never gets worse, it's actually helping you because hair loss is progressive. So if they weren't doing anything, they would have lost a lot more hair. So those products on their own, though, just don't grow a lot of hair. Not that I've seen. In clinicals over 17 years, I've never seen anyone use those and grow massive amounts of hair.
What's your theory around stem cell therapy?
So stem cell therapy injected into the scalp has a tremendous amount of growth factors. Okay, it's far better than PRP or anything like that. It was originally for sports injuries, for people with knee injuries, shoulder injuries. This was all started in Germany over 20 years ago. And they realized that if you inject that into the scalp, you can get a tremendous amount of regrowth back in hair follicles. And that's what we've been doing at Arizona Aesthetics, and it's been very successful.
How did you discover stem cells?
Well, I didn't discover stem cells. They were discovered, stem cells are within your bone marrow or in the umbilical cord of a newborn. So in Germany, they were using them, again, for sports injuries and things like that. So a lot of them will come from a donor, a healthy child. They don't take DNA, it's just the growth factors from the umbilical cord. They're tested for all disease, then they're cryofrozen, and they're sent out to doctors' offices all around the country, used for anything from joint injuries. We specifically stick to hair, and that's how I basically started in that.
Okay. So at your locations, you mostly focus on hair. What does kind of the treatment plan look like for somebody that wants to get their hair redone or they want to see growth?
Okay, so the first thing we have to do is have you come in for a in-clinic consultation, because the reason for that is we can actually look at you under a microscope to see if you're actually a candidate for the treatment. So what that'll do is when you look at hair, if somebody's losing hair, their hair doesn't just fall out of their head and never grow back. Over the course of time, it starts to miniaturize. So you have these thin, almost like a newborn baby's hair. And if they're still alive, we can look under a microscope. And if they are, you can get tremendous growth back. If it's completely dormant and it looks like, say, the palm of my hand, okay, the scalp, you're an unlikely candidate.
Yeah.
But that's the way we decide how much of a result they will get.
So who looks like a candidate? I'm 23. I don't think I'm experiencing hair loss yet. Say like 5 years down the road, I'm starting to thin. You know, right
Yes.
here, like who looks like a candidate for stem
Yeah,
cell hair
so if
restoration?
it's always better to treat it in the early stages. This is what I said. And I have kids as young as 16 years old in the office and up to 85 years old. So, but the earlier treatment that you do, the better. So at the early stages, the best thing to do is get early treatment because that will stop the loss. That's the most important part of doing a treatment is making sure that you stop the loss. That way you have a plan going forward on how you're going to basically make sure that you maintain hair. I'll use my example as a great case. So I did something early enough. So when people say, "Well, it's all genetic," well, that really doesn't make it's there's truth to that, but that doesn't mean you have no hair. So my father and grandfather had no hair. Okay, they're not alive. I feel terrible about that, but it's something I would at least bring up that they did not have any hair even at a very early age. And as you can see, I'll show you, there's quite a bit of hair on my head still. So that was all done from early treatment. So
Like
I never,
minoxidil.
yeah,
What else?
using minoxidil, an all-natural DHT blocker, having 3 rounds of stem cell treatments. Those are usually done 30 days apart. So those are the main things that have helped me. There's a lot of different gimmicks out there that I'm not a big fan of. There's, derma rollers and things like that, which in a clinical setting can really help. But if the consumer doesn't know what they're doing, they can actually do more damage to their scalp than they can, help it. For example, I had a guy that came in, was using a derma roller. He comes in, he says, I bought this derma roller and I've been using it. And I look at his head under the microscope, it looks like it's on fire because he doesn't know how to use it. And what you do with those is you want to put pressure, but you don't want to use it like a cheese grater. And so he thought the harder he did it, the better. Okay, that's actually the reverse. So when you do that, you can actually damage the tissue on your scalp, causing more loss and more inflammation. Giving that out to the consumer, if they really don't know what to do, can cause a lot of damage.
So you could tell if somebody has an inflamed scalp by just looking at them under
Oh,
an
yeah.
electronic microscope, and that will dictate whether they're a candidate or not.
Yeah, you'll see red rings basically around the hair follicle if there's inflammation around there. So if you take I'll use my daughter as an example. If you look at her scalp under a microscope, she's 24 years old, has no hair loss, there won't be any of that inflammation. Every hair will look exactly the same. So if somebody's having hair loss, if they come in and they don't know, right, the easiest way to tell is on a man at least, if the back hair, which you never lose, right? If you go on the top of their head and it looks the same as here, there's no hair loss, right? If the follicles all kind of look the same. If you start to see them colorless and very fine, thin, almost like a baby's hair, and if there's enough of those, you'll start seeing more and more scalp, and that's the issue. That then there's hair loss. But if treated early, it's like anything. If you treat it early, you're going to wind up with a way better result than the person who waits 20, 30 years to do something.
And what do you say to the people that are traveling, outside the country? They're going to a place like Turkey to get, a hair transplant done for like $3,000.
Okay, so I can go into a whole thing about Turkey. Turkey's actually very good at hair transplantation, okay? Now, I don't believe in the ones that are $3,000. I would usually say, in my belief, that from what I've seen, is between 5 and 8 are usually the better ones in Turkey. But it's it's an 8 to 9 hour surgery and at least a 2-month recovery period. So as far as Turkey, they do a good job. There's people doing them in all different countries. In America, they're just more expensive. They're probably twice the price. So if somebody pays $7,000-8,000 in Turkey, they may pay $16,000, $17,000, $18,000 up to $20,000 in the U.S. But again, though, the problem is if you're traveling outside the country, you get any kind of infection or anything, and now you're back in whether you came from the U.S. or the U.K., you're stuck, right? And so there is risk associated with that. And I always warn them. The biggest warning I give is for young guys when it comes to hair transplantation, because if you take a guy, I'm just going to use a 25-year-old guy, and he's losing his hair, and he thinks, well, the best thing I should do is I'll get a hair transplant.
Immediately go to Turkey.
Just go to Turkey, I'll get a hair transplant, I'll be fine. Okay, the problem with that is they have to predict what this 25-year-old is going to look like when he's my age, when he's 53 years old, right? And it's not that easy to predict how much hair he's going to lose. So I have seen thousands of hair transplants on guys that got them when they were in their mid-20s, even up to 30, and by the time they're 35, 40, they look terrible. Because what happened is it wasn't the surgeon's fault necessarily. They may have recreated the hairline or what have you, and then they did nothing. They didn't stop any of the loss, so then they lose all the hair behind it, right? So now they have a hairline, but nothing behind it. So that part of it, a lot of the times they're not told, what to do to make sure that they maintain that hair. We go over all that with when we're doing stem cells to make sure that they know exactly what to do to make sure they maintain their hair when they leave. It's the most important thing you could teach somebody. And but as far as flying to Turkey and doing that, I think they do have good doctors. There's very good doctors actually doing it way before this in Brazil that did some of the best hair transplants. But it also comes down to the client. There's a lot of good hair transplants in Brazil also. The concern you always have is when you do a hair transplant is, are they gonna, is it gonna look good as they age? And I've seen lots of occasions where people come in after it, and I've seen guys that come to my office that have already had 4 or 5 hair transplants, and then they're at my office because they just kept on losing
What do you
hair.
do at that point? Somebody has a bad hair transplant. What do you do?
Okay, so if somebody has a bad hair transplant, what we're trying to do is go in between the hair transplants so they camouflage so they're not as noticeable. So we can do a lot of that. So what happens in a lot of hair transplants is they'll do the front. They'll recreate the hairline, okay?
And it keeps receding.
Yeah, well, not even that. The hairline will stay, but what'll happen is they don't get any coverage at the top of their head. So they got this hairline that looks pretty decent, but the top of it is super thin. Because remember, they can only take about 30% of what you have back here, or it doesn't grow back. So they can only take 30% or you'll have no hair back here. So when they take that and they move it, there's a limitation there, okay? So what happens is they usually start here at the frontal hairline because it frames the face, and then this they leave kind of barren. Okay, so we're trying to fix that. We're trying to make sure that they get the density throughout their whole head. And we've been able to do that pretty successfully with hair transplant, post-hair transplant clients. And that happens, even if they run out of hair that they've taken from here, or they just, they went for one hair transplant and it wasn't enough. And the best way I could always say this is it's a simple math equation. Like when you're born, you could have up to 100,000 hairs, okay? So if you see a guy and he's almost completely bald, right? He may have lost 60, 70, 80,000 hairs, right? Well, if they put back 4,000 or 5,000 hairs, that's nothing. It's a drop in the bucket. So it's not, you see, that's how guys get into this 3, 4, or 5 hair transplants because they've lost too much. Now, on the reverse side of things, if you see a guy who's maybe, lost a little bit, maybe some recession, he could do okay with that. So there's nothing wrong with it. It's just the downside to it would be that it's an 8-9 hour surgery.
It's permanent,
Yeah, it's permanent. So if it doesn't work out, right, and it doesn't look good, they're not artistic in the hairline, you have no way to go back. There's no such thing. With stem cells, when you do that, it can only grow where you originally had it, okay? So if you think about that, every person that comes in that does stem cells can only look better because it's going to grow exactly where they had it as they were born, okay? When they do a hair transplant, they can actually put it anywhere. And so if they put it too low, it's going to look a little funny. And that's what usually happens to young guys. They want their hairline to be really low, right? And the problem is they think they're going to be 25 for the rest of their life. And then when they're 70 and their hairline is down here and the rest of the hair is missing, it doesn't look very good. And it's better to have less hair and not look weird. I always say that's kind of not a good thing.
Okay, so your recommendation would be you start with topicals, minoxidil, maybe finasteride, then you would progress to, say, stem cells first, and then if that doesn't work, you do a hair transplant.
Right. You always want to start with the most, a non-invasive type of treatment. Yeah. That's the best, especially if you're young. So if you're young, I can't even tell you how many young kids below 30 years old come into my office and talk about hair transplants, and an ethical hair transplant guy will
Yeah.
will unlikely do that.
What do you
But
think that is? Social media, they're
yeah,
seeing
yeah,
it?
they're on social media. They're seeing these guys going to Turkey, and it's a little misleading too, because when they take the before picture in Turkey, okay, they shave their head,
Yeah.
right? So I'm going to give you a
Who's not
hypothetical.
gonna look good,
They shave,
Yeah.
you shave your head bald, right? That's the before picture. Then all they're doing maybe is the frontal hairline. Okay, so the guy doesn't have that much hair loss. Then they show the before and after, and it's a guy who's completely bald because he shaved his head, and now you have a guy with a full head of hair. So it's misleading to what you're actually going to get. So that's a little, I want to say, an unethical trick. That's what I would say.
Okay, say your hair's thinning. Is that separate than if your hair's just falling out?
Hair loss can happen in multiple ways. Okay, so some people can, their genetics at 17, 18 turn on, and they're losing hundreds of hairs when they go to shampoo. There's hundreds of hairs in there, and I would tell them to immediately get on something like a DHT blocker, minoxidil, something like that immediately when they see that. Okay. And there's other guys that, maybe it starts in their mid 20s, and
It's more of a slow
and it's
progression.
slow. Yeah, it's a slow progression that can go over 20, 30 years. I've seen guys that come in and they'll write on the chart, normally I'd say, like, if you're under 7 years, that's the best kind of thing. But I have seen guys that come in, they'll write on the chart they've been losing hair for 30 years, but it's moving very slow. Just last week, I saw a guy that's my age, in his 50s, said he's 25 years he's been losing hair. He still had quite a bit of hair left. So it just is not moving at a rapid pace, is what I'd say. And that's and look, all things help it, right? So if you eat better, get better care of yourself, have less inflammation, you don't smoke, things of that nature. You're not using heavy steroids, things of that nature will
You want to
help.
make it, a lifestyle.
Right, right. There's a lifestyle definitely can either help you or make it happen rapidly.
Are there any celebrities that have gotten, stem cell hair restoration?
Oh, I'm sure there's hundreds of celebrities that have. I couldn't name names,
name any, yeah.
but yeah, there's many of them that combine it sometimes with hair transplantation, to make sure that they're going to get the best of both. But yeah, I would have no doubt that that's a big thing.
Say somebody's experiencing hair loss. How could they tell, at least early on, if their routine's actually working?
Okay, so so if you're young, right, and you're experiencing hair loss, okay, and you start using something like a natural DHT blocker or a finasteride and minoxidil, if you are not losing any ground, right, say you're 25 and you get all the way to 30 and you're kind of staying the same, that means it's working, okay? And the worst thing you can do is stop it and stop using it, because that will open the floodgates and it will get rapidly worse. Okay?
Is that what happens? A lot of people think it's not working.
Oh
They
yeah,
quit.
all the time. You'll see somebody go in and they've used it. They used maybe they used Rogaine for 5 years, and maybe even finasteride, and they go, yeah, I used it for 5 years, but it didn't grow back all my hair, so I just quit. And their hair loss will get drastically worse in a very short period of time. I mean, because what's happening is, think of it this way: you're blocking the root cause, right? And if you take that away, the floodgates open up, and then poof. I had a friend that lived in our neighborhood back, this has got to be back about maybe 10 years ago, was using finasteride only. And he asked me a question. He said, you think I should keep using this? And I said, well, you got most of your hair. Are you losing any hair? He goes, no, I'm not losing any hair. I go, well, I think it's a terrible idea to go off of it. And he goes, well, maybe it'll just stay the same. And I said, it definitely will not. I go, but that's up to you. I go, did you have any side effects from it? No. Oh, okay. Well, he went off of it, and let's just say he called me within 3 months to go right back on it. Okay. So basically what was happening is it was stopping his hair loss, and then he goes off of it and just, 20, 30% of that hair will be gone quickly. Yeah. So it really is doing something. Right. It's got to be part of your lifestyle. If you just want to, if you think that's like a magical pill that you're just going to take and, that's unlikely.
But that's not with any medicine.
It isn't. Yeah, exactly.
You have to keep taking it repetitively. Or
Of
else
course, yeah. As soon as, like any medicine, if you stop taking it, it stops working.
basically
Right?
a symptom blocker. The symptoms, your hair is falling out.
So if
Take a
you,
pill, it's gonna help you with your hair falling
right.
out. The second you stop taking it, what do
It's
you
like with
expect, you know?
most things. Look,
Yeah.
we have people that come that I've seen that do Botox, right? And they go, "Well, I got to keep doing
Yeah.
Botox." Well, if you stop doing it, your wrinkles come back.
Yeah.
Like that's just the way it
It's
is.
as
Like
simple as that, yeah.
it's not super complicated, but I think they get misled because on social media you will see everything crazy stuff. You'll see shampoos, right? That somebody will be, hawking some
It's mostly a
shampoo,
sponsored
a
post, you know?
sponsored
Yeah.
post. And they're hawking a shampoo, $100 shampoo. Okay, well that's the surface of your scalp, right? So you'll have a very clean head, I'm sure, but you're not growing any hair with that. There is no way that would work. I've never seen that. Same thing if somebody's using like a rosemary oil. There's nothing wrong with that, okay, but that's not going to grow massive amounts of hair. Okay, it'll take down some inflammation. It'll do things like that, but that would be part of a routine. So, like, yeah, if you were using rosemary oil, what I would tell you is to take, maybe 10 to 20 drops and put it in your minoxidil. Okay, that can help. Okay, because now you're getting a little bit of both. You're getting some help from the minoxidil and some anti-inflammatory properties from the rosemary oil. But you're not, even in those best circumstances, you're not growing massive amounts of hairs like you would from a stem cell.
Do you think the industry is moving away from, surgical procedures towards regenerative therapy? Do you think you're seeing like a shift in the industry? Most people don't want to get surgery now, and they're opting for regenerative therapy.
Yeah, and in my office in Scottsdale, we'll see, I can tell you on certain days, we'll treat 17 to 20 people a day. Okay, so think of that. When you go to a hair transplant clinic, I mean, most, at least in the US, they can see one patient a day because it's an 8-9 hour surgery. So it's going against that, but that's not the only reason. One of the reasons is there's two reasons. One, the thought of, for a lot of people, of getting their scalp cut is not really, they don't like the idea. The idea just sounds brutal, right? And there's some of the videos they'll watch, it looks pretty brutal. You're going to look pretty bad for about 6 to 8 weeks. So that's part of it. And then also that they can come to an office like ours, get a treatment, right, and then leave and go right back to work, and nobody knows. The same day, nobody knows, because when we use is an insulin needle. So by doing that, you can't tell. 5 minutes after they leave, and there's no downtime. So guys that like to say work out, like there's no problem working out. There's no issues with stuff like that. Where transplant, you're not working out. You have bandages on that for quite a while. So you're not going to be working out or doing anything like that for quite a while.
So say I wanted to get, a stem cell hair restoration. I come into your office, what happens?
So initially there's an intake form. We just want to see if you're on any medications, what's your diet like. Then we'll basically, what products you may have used. We'll bring you back. We'll look at you under the microscope to see if you're a candidate, right? That's the number one thing that you have to do to see if that person's going to get a result. And when you've treated thousands of people, you know who's going to get a result based on the miniaturization of their hairs. Is it there or it's not?
It's that simple.
It's that simple. If they've got miniaturized hairs, this treatment will work. If they don't, right, there's nothing there, it's completely dormant, then that's not a really good candidate. So that's how we do it. Then we would schedule you, show you how to use the products that we have, and then schedule you for your first treatment. They take about a half hour, but it's very quick. It's painless. It's not anything. You can drive yourself to the office. You don't need anybody to drive you. So there's really no restrictions when it comes to stuff like that.
But what does the stem cell treatment actually look like once you're a candidate, you go in the office?
Okay, so the doctor or nurse will come in. Okay, they'll usually give you a squeegee ball, and what that does basically is, it makes it so you keep your mind off that there's a tiny needle pressing into your scalp. So what they'll do is you'll kind of squeeze that, and they'll go across your scalp, starting at the frontal hairline, and there'll be injections. But again, the needle is the size of an insulin needle, so it feels like somebody's pinching your skin. So they'll do that through the front, the top of the head, the crown of the head. They just don't touch the areas back here or the sides because you're not genetically going to lose hair there. Now, that's for men. It's totally different for women. Okay, so women can lose hair over here. They can lose hair on the back. They can lose hair on the side. So all different areas, okay? It's totally different because it can be from hormones, or it could be from inflammation, it can be from diet, all these different things. So in their cases, there's times where we've treated ladies that have lost hair right back here, big chunks of hair, okay? So, but it's the same process coming into the office, right? We have to look at them. For the female clients, so it's a little bit more of a detailed, okay? So for the men, we kind of know exactly why all men are losing hair. It's not a mystery at this point, right? Okay. So for the women that come in, the average woman that comes in the office is about between 40 and 65 years old, okay? And that's usually a sign that it could be premenopause or a menopausal hair loss. So their hormones are changing, right? So when a woman's very young, in their 20s, even up to 30, 35s, they're estrogen dominant, okay? So as they age and they go into menopause, they become less estrogen dominant. Estrogen protects their hair. So when they get into their 50s, they can, and this is in much smaller amounts than men, you're probably talking maybe 15%, that lose hair, that DHT could actually affect their hair. Dihydrotestosterone could affect their hair and have their hair thin. So women, and women also lose hair in a different pattern. So men typically can recede here and have a bald spot back here, right? Okay, that's male pattern hair loss. Women tend to diffusely thin, which means it can go thin from the front all the way through the head. So meaning kind of like see-through. So like if you see that, that's what's called female pattern hair loss. It's just different. So, treating them, the stem cell treatment's the same, but you just got to make sure there's nothing that's aggravating it, right? Are they taking hormone replacement? You just have to know what they're taking to kind of make sure that you're able to treat them.
And is this kind of like a targeted spot treatment, or are you just basically
No.
injecting it in equal amounts?
Yeah,
in all
throughout.
areas?
Yes. So we treat the whole head, and the reason for that is you want it to come out even.
Okay.
You don't want to just hit one area, right? And then that area is dense, and then the other areas aren't. So, and it also protect the other parts of the scalp from future hair loss too.
Okay. What are the different, types of stages of hair loss?
So the different stages, there's, when you start off, you're just seeing a mild recession or something like that, or a small thinning at the crown, right? That's the initial sign, especially for men, that they're losing hair. I think that's the best time to take action, right? Like if you just see that, you'll know, right? If you see a lot of hair on your pillow, or you see a lot of hair, in the sink, or when you're shampooing, that's the early signs for guys. And that can be, like I said, at 16, 17, 20, 25, anywhere in those ranges. Those are the majority of it.
For men, is hair loss usually, the biggest insecurity they're experiencing, at that time?
Oh, no question. So for the younger guys, say guys below 30, okay, it can be devastating. And if they're below 25, even worse. You'll find a lot of them will become more, they'll want to stay home more often. They'll always be wearing baseball caps. They're embarrassed by it because it's not as common, right? So if you see a guy who's 60 and lost some hair, people don't think about it as much. But if you look at your friends, right? Like I'll tell you a great story. So when I went to my reunions, right? High school reunions. So when you go to a 10-year high school reunion, you're roughly 28 years old, okay? So most of the guys have hair, okay? So my second one was, I was 38 years old, okay? So I go to my second one, and this is in New York City, and unfortunately, they forgot to hand out the name tags, Went to a reasonably big high school, but I knew enough people, right? And the name tags hadn't come yet, so people are coming up talking to me, and I'm realizing this guy's got no hair. Like, who is this guy? Like, I don't know who he is. I can't tell because he looks so different, right? So then finally, about 10, 15 minutes later, the name tags come on. I go, oh my, that's that guy. I know that guy, but 10 years ago, he had hair. Now he's nothing. Okay, so it can happen really quite quick. So, and then forget about it. You get to the 30-year reunion, you'll have 85% of them have nothing.
Or is it really that quick, or are they just not doing anything to prevent it?
Most likely not doing anything to prevent it.
They just say, like, maybe it'll go away.
Still, my guess is that it bothers them, but but maybe they don't know what to do, or they've tried, a lot of guys, I hear this all the time. A guy will go, I'll come in and look at his chart and he'll say, yeah, I used minoxidil. I go, how long did you use it for? I don't know, like a month or two. I go, well, that's a waste of time. You're not going to get any results with that. You have to use that 6 months to a year to know if it's doing anything. If you use it for a month or two, you're just wasting your time. That's not going to not be beneficial at all.
I think a lot of it is like once you start to look into like say a hair transplant or stem cell hair restoration, that's at the point it gets like pretty serious. A lot of the dudes, I think they kind of try and put it off, not accepting it, basically.
Or they'll grow their hair long, right? That's one of
to just cover, you comb it over,
right, yeah. So the common thing is like a guy will, he'll be losing hair maybe back here, but he'll grow it really long and kind of swoop it over. I mean, you're not fooling anyone, but like it's, they're trying to do the best with what they can. But I don't think any of those things really look good. Actually, if I could give any advice, if your hair is really thinning, it looks better if it's short. It does not look better if it's long. It looks worse.
But if those dudes, say they're balding, they're 35, if they could have just went back in time at 25, done the minoxidil.
Oh yeah, they'd be able to keep their hair, no question.
Eventually stem cell therapy, they would have had
yeah, they would be able to keep their hair their whole life. No question about it. It's early treatment is the best. If you go too far down the road, it makes it difficult. And that includes hair I tell this all the time. If you wait too long, forget about a hair transplant. You're gonna, that's never gonna work. I mean, in the long term, you're gonna have a very patchy result at best. So, yeah, that's not a great look, to say the least.
What do you say to the people that think hair loss is all genetic?
Well, partly they're correct, except getting on top of it and stopping that hormone. So it's a hormone, dihydrotestosterone, is what causes it, right? Okay, so if you block some of it, you don't have to block all of it. You can do that by a couple of different things: ketoconazole shampoo, natural DHT blockers, which have pygium, stinging nettles, and saw palmetto in them. That helps, along with maybe a minoxidil that has what's called azelaic acid, and that actually blocks DHT right at the follicle level. So if you do those things, you're basically blocking the cause of it, right? And that's the most important thing. So no, I don't. I think in today's world you have a way better chance. Now, if you go back into the 50s and 60s, and a guy was losing hair, I'll use my father. There was no treatment. There was nothing. The minoxidil was a prescription, but that came out in the late 80s. Okay, so think if you were born in the 40s, right? And you're in college in the 60s, right? Like there was
not much you could do, yeah.
There was no treat. There was actually really bad fake treatments out there where they would tell you the shampoo that your follicles were all clogged, then you could just use the shampoo and it would unclog your follicles. They didn't know. Maybe they didn't know that it was a hormone that was causing it, right? And by the way, another quick story, and this is not at 100%, but if you want to know somebody that has a more of a likelihood of extreme hair loss, okay? So, and again, it's not 100%, but it's pretty close. If you go to the beach, right? Okay, so now I tell you the story. Next time you go to the beach, you're going to look at this guy and go, oh my God. So if a guy has what I call a full sweater, takes off his shirt, hair all over the chest, all over the back, completely covering his whole body, okay? The chance of him having any hair on that head is less than 1%. I mean, he will, in the majority of cases, be completely bald, okay? And that's because that hormone actually produces a lot of DHT, which grows massive body hair and takes it all off the top of your head. It's kind of a cruel joke.
Yeah.
So it's not not exactly, but you'll see it, So whenever I tell somebody that in my office, they always go, oh, yeah, I was at the beach. I went to California, and this guy took off his shirt. He looked like a wolf, and not one hair survived his head. I said,
like you're transferring it from the top just to your chest.
Right. So I actually have had another story. I've had a guy that ran out of transplant hair. So he had 4 or 5 hair transplants, and he ran, you run out of hair from taking hair. So they started taking hair off his chest, okay? So they're basically extracting hairs off his chest and putting it on his head. The problem is, if you ever look at chest hair,
It's real curly.
it doesn't look the same. So he has straight hair and then these curly, wiry things. So not exactly a great cosmetic look. So I would highly recommend against that. But they also do that with this doesn't work that good either. They will take it from the beard. They'll actually take the follicles from the beard, but the beard can be real coarse, right? So again, that's not a really great solution for that. So that's nothing I would recommend. That's for sure.
So before this conversation, I was doing, some research on other stem cell clinics.
Yeah.
I happened to see a couple clinics, that do just a one injection stem cell shot. What's kind of your approach? I know you mentioned you did 3. Why 3 instead of 1?
Right. So due to the hair growth cycle, you really need to treat it at least 3 times, okay? Usually about a month apart. One injection, I hate to say it, will never work. I don't care what stem cell you're using. I've never seen a result from that. So the 3 treatment protocol is what they were doing in Germany, and that's what we do. If somebody has extreme loss, they'll have up to 5 sessions a month apart. But yeah, I think so what happens there, okay, this is my opinion, okay? So when you do a stem cell, let's say somebody has a rotator cuff injury, right? And they're going to do a stem cell treatment on that rotator cuff. It's likely that they'll only need to do 1 time. If they find where the injury is with an ultrasound, they'll go in there. The majority of them are 1 time, okay? So they take that knowledge and try and transfer it to hair, and it's not the same thing. It is completely different because you have a hair growth cycle. It's much more complex than dealing with that specific injury. So I've never seen anyone do a 1 shot and get literally any results. Like I would, if somebody wanted to do that, I would never do it on them.
Okay, take yourself back to when you were 20. Say your hair's starting to thin, some hairs are falling out. What are 3 things you would do to prevent future loss and gain what you've already lost?
Okay, so if you just started, you're 20 years old, right? And you're just starting to see a little bit of loss, but your hair's still looking pretty good. I would get a ketoconazole shampoo, meaning a shampoo that has ketoconazole in it. I would also make sure that you use a little conditioner after you use that because it can be quite drying, especially in a desert kind of landscape. I would use a topical minoxidil, preferably, if a compounded one, but you can do, standard 5%. You don't actually need to use it twice a day. We've actually tested it where you use it and twice a day doesn't really grow any more hair. I would just use it nightly on your scalp before bed and then rinse it out the next morning. And then I would start at 20 years old with like an all natural. I wouldn't start necessarily with finasteride because of the side effect profile in a young person. I would rather have them do like an all natural DHT blocker that has saw palmetto, Pygeum africana, and stinging nettles in it. That's the 3 main things. They may have other things in it, but those are the main things that actually block some of the DHT. That's the number. If that was somebody in their early stages, that's what I would do. Then if it progresses, then you want them doing something like stem cells and things like that as it progresses.
Okay. Why don't we show your hair to the camera, and then basically we'll go over what you actually do for your routine. So let's see, show us where you were starting to thin before you started this, and then let's see it now.
Okay, so all through here was very, very thin, okay? My routine, like on a daily basis, even today, okay? So I will use a shampoo that's got ketoconazole in it. Usually I'll use that a couple times a week. The other times I'll just use a sulfate-free shampoo. I'll use an all-natural DHT blocker, okay? Now at my age, I can use finasteride. I have used that in the past. Sometimes I'll alternate the 2, okay? So one day I'll take the natural one, and then the other day I'll take a finasteride. So you can do that too. Finasteride will block about 70% of the DHT. And then a topical minoxidil at night before bed. You can also use, occasionally I'll use even stuff like, I've already had the stem cell treatment, so it's not something you have to keep doing, right? So that was years ago. 7 years ago. So it's not something you need to keep doing. So the other things, all of what I'm doing now is maintenance to try at 53 to make sure it looks the same at 63, 73, 83, right? So even if you use like red light therapy, that can help with maintenance. So that's what I'm doing currently. Basically, what I'm looking to do right now at my age is just to maintain what I've got. And if you think about it, when you're 53, the majority of your friends don't have any hair. So if you get to 63 with the same amount and 73, so I have more now than I had when I was 33. So, so think of it, if you're 63, you're going to be way ahead of the boat from the rest of the people that don't do anything.
Yeah, so I know there's a lot of guys that, they're in their 20s, they're getting hair loss. They get on finasteride, and it comes with a very unwanted side effect, low libido. Does hair loss have to be a trade-off of low libido or, having your hair back?
No. So if when a young client comes to me, okay, I'd have to treat him like he was my kid. So the problem with finasteride, and this is just, again, my opinion, okay, is that it was originally a prostate medication, right? So for enlarged prostate. So if you're a 50-year-old guy, 55-year-old guy, you're gonna, at some point you're gonna have an enlarged prostate. We all will, okay? And that shrinks the prostate, right? The problem with that is, so at 55, you give it to a guy, he's less likely to have any of the libido or erectile issues, right? But if you give that to a 20-year-old, right, his prostate is in perfect condition. So now you're tinkering with something that really doesn't have an issue. So the side effect profile in that I've seen, from what I've seen, is way higher of them having that. So what I would do is just use a natural product that doesn't cause that. So if you use the ketoconazole shampoo, it's a topical. You use the all-natural supplement instead of that. That's what I would do at a young kid's age. You don't want to start tinkering with a kid's hormones that's very young. You could be doing more damage than helping them. So you don't want to fix their hair and then have them have this erectile issue. That's not what I consider doing somebody any favors. So I think, like I said, that's what I would do. And as long as they, now again, if they've tried finasteride, I've had clients that are young that have tried finasteride, they didn't get the side effect. Well, then there's no problem, right? So then they can just go on. They can use the stem cell treatments. They can use the minoxidil, things like that, and that's totally fine. So it just depends on the person. Not everyone's going to get that, but no. So it's not definitive as far as that.
How could you open up a successful stem cell hair restoration clinic?
It's a licensing agreement. We have, so currently now we have 5 in California, 5 in Florida. We have 3 in Texas. We have 1 in Nevada. I know I'm going to leave somebody out here, but 1 in Washington, D.C. But anyway, so the point to that is, what we do is, now it can be two different people that invest in this. And what they do, it can be an investor guy that comes in, and then we set him up with doctors and nurses to work there. We also set him up as a turnkey operation, meaning when he gets in there, we're going to do all the marketing for you. We're going to set up your website. We're going to make sure that you have all the before and after pictures, all the consent forms, all the posters, everything you need to have. The only thing an investor or just somebody that wants to do this as a business would need is they'd have to rent an office. We actually even give you the square footage of what you would need for an office. And we set you up with a nurse and a medical director. The only thing you really need to do is we train you in our office. Basically, it would be somebody that's knowledgeable. Myself, I do most of the training. And then for the person who's going to be doing the sales, to see if the person's a candidate. We have to train them how to know who's a candidate and who's not. So we've had a lot of people doing it, and most of the people that have opened up a clinic, for example, we had a person in Dallas. They opened up a clinic in San Antonio within a year of doing it. Also, our Colorado licensee has one in Houston, Texas. We also are having a person in Florida that's in Tampa, is doing Jacksonville, Florida. So it's, it's been very successful because, we actually are doing everything for you. So it's all set up for you. You just have to have somebody that's willing to learn and be knowledgeable to be able to tell the clients like, hey, this will really work for you or it won't work for you. But as far as that, it's a great business. You know, we'll have more information on a website of how to contact us about, if you're interested in that. But again, I'm even doing training tomorrow from a guy that's his first clinic is in San Francisco, and he's coming out here to train. Now, some people too are owner operators, right? You'll have sometimes it's a husband and wife, that want to do a business like this because they're really interested in it. And it's a great business. You're really helping people. You have to look at it that way. When I sit down and talk to people about it, right? You get investors and they always want to talk about money, how much money can I make, right? And I go, listen, think about it this way. If you can help people, that's what your mindset should be. The person that's coming in, can I help them? And if you do that as your mindset, the money will come. Never think of it reverse. Don't think money and then help. You have to think help the person and then the financial gain will be there, right? I always think that's, it's good karma to do it that way. And I just think that's the way it should be done. You'll get all the training from us. We actually provide all the stem cells. We provide all the hair care product that you're going to be using. So when somebody comes in there, they don't have to worry. And actually, one of the hardest things is the marketing, right? Our marketing is very good at getting leads. So that part of it, we set up and do it all for you. So that makes it, an easier business to start, right? And to turn a profit very quickly. And you have to to do it, you have to want to be helping people. Think about it that way. Because the people that come in, now the guys that come in, yeah, they're worried about their hair. But I will tell you this, the ladies that come in, they're extremely worried about their hair. So you have to know how to navigate that, right? Like, so if you have a lady comes in she's 50 years old and her hair is all falling out, right? She's very worried, way more worried than any male. So you just have to you have to be compassionate to them. You have to you have to see it from their perspective. Like, what would what was that, if that was you, or if that was your wife, if that was my wife or anything. So, from that perspective, I think it's, but a great business. We've had a lot of people that have been interested in it, and it's something that our technology is always getting better. So we're getting better at it every year that we do it. So if you want your own business where you don't have to work for somebody, it's something that, it's really something that I think, and also it's just at the beginning. So you're getting into a business that's, growing very quickly, but you're at the beginning stages, which is always the best.
Okay, so I know you basically sell a licensing agreement to anybody that wants to open up a stem cell hair restoration clinic. Does that person need to be a doctor? Does it need to be an investor? What does that look like?
Okay, so no, the owner does not need to be a doctor. We set you up with a medical director and then a board certified nurse. Okay, so that's usually the people that are, the medical director is overseeing it. The board certified nurse is usually doing the injections. So no, many of the people, actually most of the people are investors, not necessarily doctors. Okay, so no, you don't need one. We set you up with all of that.
Okay, and what is the basic return that some of these clinics are seeing across the United States?
Okay, so the return has been very big. You're talking about in the first year, our Colorado office did $1.2 million in sales. So roughly, they're going to take home $500,000 to $600,000 in their first year. So as far as a business, it's very profitable to say the least. And that's been the way it's been for almost every office that's opened. And that's why we see clinics opening up, existing licensees opening up second and third locations.
What makes it so successful, in comparison to basically just doing it all yourself?
Oh, yeah, yeah. So that's a very good question. Okay, so say somebody decides to do it all themselves, okay? Very difficult to do. Over 17 years, I have, thousands of before and after pictures. So if you just decide to waltz in there and do it, you have no pictures, right? So how is anybody going to know any of this works, right? You don't know how to get what stem cells are you going to use? Do you know anything about stem cells? Are you going to buy the right ones? Do you get the right price, right? Like we're buying in mass volume, right? So we're going to get the way better price for our licensees than you're going to get, if we buy 500 bottles, is going to be a lot better price than somebody who's buying 10, right? So that's part of it. And most people don't have any idea how to market hair. It's a very niche business, right? So they may know how to market, a supplement or whatever they're marketing, a product, right? But they have no idea how to market hair. So it's a very niche business. You really have to know a lot. And so when a licensee comes in, we give them all that information. So we've rarely seen anybody to even try. And the ones that I've seen over time that have tried usually don't last. They usually go out of business.
So tell me about your startup, TerraTrichology, the basic, cosmetic company, shampoo company. Tell me about that.
Yeah, so TerraTrichology is our product line. Okay, we have a sulfate-free shampoo. We add ketoconazole in it, which helps reduce DHT on the scalp. Then we have an organic conditioner, just to make sure that there's no sulfates in any of those products. We have a topical. We have two types of minoxidil. One is a 5% liquid, which is a standard one that we use. It can be used for either men or women. We also have a foam one that has what's called azelaic acid. So it's 5% minoxidil mixed with azelaic acid, which actually helps reduce DHT on the scalp. So some people like that better, depending upon the client. We also have an all-natural DHT blocker, which basically is like think of it like a finasteride without the side effects. It's an all-natural supplement, so there's no side effects to that. So that's our product line, and so all of the licensees buy that wholesale, and that's part of. So when you're running the office, the first couple months while they're getting treatment, included in that treatment is some of those products, right? So they understand, okay, this is what we're going to be using to try and help you stop the loss, and then the stem cells will actually grow back the hair. But it gets them used to using something and understanding what that's used for and what the stem cells are used for. So they really get a good gauge of what to do when they leave too.
So you're giving the licensees basically the know-how.
Correct.
You're giving them the medical staff, and then you're providing the products for them, and basically, an encompassing full stack solution.
Correct.
They don't really have to do anything besides
just train a salesperson.
Just pay payroll.
Yeah,
basically
they've got
operate the business.
Yeah, they have a person answering the phones, right? The nurses are paid basically like 1099, so they're paid per injection. So it's a private contractor, not an actual full-time employee. And then you've got if you're an owner operator, you'd be the one doing the sales for it, right? You'd be in there, you'd get training from me so that you really are an expert at it. So we actually go through 3 levels. We give you 3 levels of training where you'll actually get 3 plaques that you've completed the training of level 1, the training of level 2, the training of level 3, just to make sure that we know that you're out there giving out the exact information, the real information.
It's going to get results.
That's going to get results so that they can, and you really want to, like I said, if you're really out there to help people, you have to give them that information. And if I always felt like in this business, one of the things I didn't like that I wanted to change was like a lot of people just going, here, do this, and that's it, you're done. Yeah, take this one injection and goodbye, everything will be fine. And then that doesn't work. It doesn't work like that. So having the knowledge to really know what to do and to help people, you'll have a lot of people that will really like if you look, that's why our reviews are so good, right? The reviews are really good because we're giving people honest information. People can feel that, like if you ever look at some of the reviews, they'll all say, I feel like they really cared about me. And that, if you look at it from that perspective, you'll do a great job with it.